If you're experiencing any of these, then there are possibilities that you may struggle to get pregnant. If you notice any of these signs, whether you're still a single lady or you're not yet ready to start having children, then you might need to go to the hospital, get examined, get treated before you start trying to conceive. So that is what we're going to be discussing in this video today, some signs that you might struggle to get pregnant. So hello guys, what's up and welcome back once again to my channel. This is Everything Health with Nurse Dara. In this channel we get to discuss different topics related to health. If you're seeing this face for the first time, I am Nurse Chidera Cynthia. I'm a registered nurse, registered midwife, registered public health nurse, and a Bachelor of Nursing Science degree holder, currently practicing here in Nigeria. If you're interested in this topic, keep watching. So if this is happening to you, then you may struggle with infertility. Now, mind you, that doesn't mean that if you're experiencing one of these signs, then automatically you're going to struggle to get pregnant. First of all, what is infertility? Infertility is when a couple have unprotected sexual intercourse constantly for a period of 12 months, like consistently, regularly, for a period of 12 months without getting pregnant. That is when you can say that a couple is struggling with infertility. For ladies above 35 years, if you have regular unprotected sexual intercourse for a period of 6 months and you're unable to get pregnant, then you need to go to the hospital and get that checked out. Now, here are the signs that you may struggle to get pregnant. Let's start with menstruation problems. Are you having abnormally painful periods? If you're experiencing abnormally painful periods every month, too painful that you're unable to carry out your daily activities, you're always in pain whenever you're on your period, then you might need to go to the hospital, get examined, and find out what the cause is. This may be a sign of endometriosis, and I have a video where I explained in details about endometriosis, the causes, the symptoms, the treatment in my channel. You can check it out. Endometriosis can affect fertility. It might make it more difficult for you to get pregnant. The second one is extremely heavy period. You can soak through one pad under 2 hours. It might be a sign of uterine fibroids. So you need to also go to the hospital, find out what the cause of this extremely heavy period is, and get it treated. If the fibroid is submucosal fibroid, that is a fibroid found within the uterine wall, inside the uterus, that is on the uterine wall where your baby is supposed to implant on and develop after fertilization, then this might make it difficult for you to get pregnant. So if you're having extremely heavy periods, then you need to also go to the hospital, find out the reason, and if there is an underlying illness causing that, get that treated and you'll be fine. I also have a video on fibroids in my channel. Another sign is irregular periods or absent periods, when you can go for months without seeing your period. Sometimes within a year you get your period only 2 times or 3 times. If this is happening, it also means you are not ovulating, and without ovulation you cannot get pregnant. Ovulation is simply the release of egg from ovary into the fallopian tubes, where the sperm is going to meet the egg, fertilize the egg, and then implant on the uterine wall, and that is how pregnancy occurs. So if you do not ovulate, pregnancy cannot occur, and most of the time this is caused by a condition called PCOS, polycystic ovarian syndrome, and if that is the case, you need to get treated. Another sign that you may struggle to get pregnant is if you have history of STIs, sexually transmitted infections that are not properly treated. For instance, gonorrhea, chlamydia, and the rest of them. These infections can ascend from the vagina through the cervix into the uterus and the fallopian tubes. They can cause inflammation, scar tissues, and adhesions, and this will make it difficult for the lady to get pregnant. These infections can lead to PID, pelvic inflammatory disease, and when there is scar tissue developing on the fallopian tube, that is where the egg and the sperm will meet and fertilize and travel down into the uterus and implant, and a baby is formed. So if the fallopian tube is blocked because of these scar tissues, there is no way the sperm will be able to meet the egg. Even if it eventually meets the egg, there is no way the fertilized egg will be able to travel down into the uterus and implant there and begin to develop as a baby. So this can lead to infertility or even ectopic pregnancy, because the fertilized egg might eventually implant on the fallopian tubes there when it's unable to travel into the uterus and start developing there on the fallopian tube. This can lead to ectopic pregnancy, which is highly risky and is a gynae emergency. Another sign is being underweight or overweight. Being extremely underweight can reduce fertility by causing hormonal imbalance, which may affect ovulation, while being overweight impacts the production of gonadotropin producing hormone, which is essential for regular ovulation. The next sign is hormonal issues or changes. You might not be able to determine this on your own. You will need to run hormonal tests in the hospital, check your values and be sure they are all okay. Changes or hormonal imbalance may impact fertility and it might make it difficult for you to get pregnant. But here are some signs that you may be struggling with hormonal imbalance or hormonal issues. We have acne, hair growth on the chin, the chest, which is also called hirsutism. This is usually common amongst people with PCOS, that is polycystic ovarian syndrome, which is also a hormonal issue. Then unexplained weight gain, cold feet and hands, reduced sex drive, nipple discharge, that is noticing fluid which looks like milk coming out from your nipple when you're not pregnant or breastfeeding, thinning of hair, and so many others. These are some signs that you may be struggling with hormonal issues. If you notice any of them, you may need to go to the hospital, get examined and get treated. Another sign that you may struggle with infertility is if you engage in some of these lifestyle, like doing drugs, smoking and drinking. This affects both men and women and it reduces their fertility. It can upset hormonal imbalance, impact fertility and lead to sexual dysfunction. It can damage the DNA of sperm cells and reduce sperm motility. Another sign is age. So studies have it that as a woman gets older, her chances of getting pregnant naturally begins to reduce. By the age of 30, fertility starts to decline, and by the time a woman gets to her mid-30s, that is from 35, the decline happens faster, and by the time she gets to age 45, her fertility declines so much that her chances of getting pregnant naturally is reduced. And this is because women are born with a certain number of eggs. It just matures and you release it during your ovulation every month during your cycle. So as you get older, the number of these eggs begins to reduce. These eggs begins to reduce in quality and quantity, and this might make you struggle to get pregnant naturally. Another sign that you may struggle to get pregnant is pain during sexual intercourse. Are you always experiencing severe pain whenever you engage in sexual intercourse? This might be a sign of an underlying condition like uterine fibroids or endometriosis. So if you're always experiencing severe pain during sexual intercourse, then you also need to go to the hospital, get examined, find out the root cause and get treated. Another sign is low or no sex drive. This can be caused by stress, anxiety, depression, sexual problems like erectile dysfunction in men or vaginal dryness in women. The last sign on my list is nipple discharge. This is caused by overproduction of the hormone prolactin in the blood, also called hyperprolactinemia. This hormone is responsible for milk production in women who just put to bed, pregnant women and nursing mothers. This hormone helps with the production of breast milk for the baby and it can disrupt ovulation. This is why women who are breastfeeding, especially those doing exclusive breastfeeding, do not usually get pregnant, because the high level of this prolactin in their blood making the breast milk to come out is going to inhibit ovulation. It's going to stop ovulation, and if it stops ovulation, she cannot get pregnant. So if you're experiencing this nipple discharge when you are not pregnant or breastfeeding, then you need to go to the hospital, see a doctor. He's going to prescribe some over-the-counter drugs like bromocriptine. Just take the drugs as prescribed by your doctor and you'll be fine. So with this, we've come to the end of today's video. If you had fun watching, don't forget to give this video a huge thumbs up, subscribe to my channel, leave a comment in the comment section if you have any questions, and I'll be there to respond. Turn on your notification bell because I have more informative and educative videos coming your way on this channel. This is it for now. Stay tuned. Thanks for watching and see you in my next one. Bye.